Agwina Ushla Akorja. My name is Miriam Cunningham. I'm pleased to share insights into the motivation, methodology and achievements to date of mHealth4Afrika. In the context of UN Sustainable Development Goal 3, governments around the world are working towards strengthening the impact of, as well as increasing access to healthcare delivery. Coherent strategies and enabling regulatory environments are required to support universal access to patient-centric healthcare delivery. Equally importantly, appropriate skills development programs, including digital literacy, are required to provide the necessary foundational capacity to facilitate complementing available medical expertise with appropriate health-related technology. In the context of a significant shortfall in available medical professionals in resource-constrained environments, particularly in African, Caribbean and Pacific Group countries, appropriate technology adoption has an important contribution to make in the context of strengthening impact of and scaling access to healthcare. If technology is to be widely adopted in healthcare ecosystems, the minimum requirement is an appropriate electronic health record, which WHO defines as real-time patient-centered records that provide immediate and secure information to authorized users. EHRs typically contain a patient's medical history, diagnosis and treatment, medications, allergies, immunization, as well as radiology images and laboratory results. Despite progress being made across ACP countries in introducing electronic patient records in large urban hospitals, paper-based registries are still the default data capture method in most primary healthcare facilities, particularly in Africa. Unfortunately, many of the technology solutions introduced by donors in recent years have tended to address the specific program that they are funding, such as ART or TB, for example. Few eHealth or mHealth solutions to date have adopted a holistic approach to patient-centric care, or reflect the range of necessary services provided to local communities. There is now an increasing realization that using siloed eHealth or mHealth solutions is not sustainable, as they tend to have a negative impact on the overall continuum of care, wasting scarce resources through data fragmentation and duplication of effort. 3 years ago, mHealth4Afrika secured funding from Horizon 2020, the European Commission Research and Innovation Programme. Our objective was to design a comprehensive, patient-centric health platform for use in resource-constrained environments around the world. Designed to be adaptable and extensible, modular and multilingual, mHealth4Afrika integrates electronic health and electronic medical record functionality with the use of medical sensors and data visualization tools at the point of care. It supports automatic counting of aggregate program indicator data required by the Ministries of Health, SMS, appointment notifications and decision support. Integration has also been undertaken with a system designed to streamline laboratory tests for patients. The objective of mHealth4Afrika is to strengthen primary healthcare delivery in resource-constrained environments by replacing on a staged basis both hard copy patient registries and any siloed or program-specific electronic health solutions currently in use. mHealth4Afrika is working in partnership with Ministries of Health, district health offices, clinic managers and nurses in primary healthcare facilities and hospitals in Ethiopia, Kenya, Malawi and South Africa to inform the required functionality, workflow and usability requirements. Our approach to sustainability is based on building local capacity through collaboration with local university partners. mHealth4Afrika aims to assist primary healthcare facilities to increase the quality and impact of care by strengthening the capacity of primary healthcare professionals to diagnose and treat patients. It makes it easy to both capture comprehensive histories and current medical conditions, and identify potential trends or risks based on previous visits to support continuity of care and follow-up. mHealth4Afrika supports a prevention-focused health strategy by focusing on leveraging appropriate technology to strengthen community trust in primary healthcare delivery to encourage greater frequency of contact across all healthcare needs. mHealth4Afrika can save valuable clinical time at health facility level through automation of aggregate program indicator data, while supporting strengthening of decision-making and policy formulation by significantly increasing the accuracy of this critical resource used by district health offices and Ministries of Health. mHealth4Afrika aims to strengthen clinical and diagnostic skills at healthcare level by facilitating on-site access to critical educational materials from nursing and medical schools. When developing mHealth4Afrika, collaborative open innovation and design science research techniques and an agile development process were applied. Necessary ethical approval was also secured in each country. We worked closely with policymakers, district health offices, clinic managers and facility workers to co-design and validate a number of alpha and beta iterations of the mHealth4Afrika platform. This iterative consultation-based approach helped accelerate both prioritizing and incrementally refining program-related data sets, necessary functionality, workflow and usability issues. Qualitative data collection and ethnographic observation techniques were used during the needs requirements and the baseline study and the alpha and beta validation phases. While addressing the mandatory program-related data sets required for use in Ethiopia, Kenya, Malawi and South Africa, when implementing the medical programs such as maternal, child under 5, TB and ART, for example, mHealth4Afrika was co-designed from a cross-border perspective. Rather than simply replicating country-specific paper-based registries, which reflect the best medical knowledge at a point in time, mHealth4Afrika reflects advances in medical knowledge. By building it around a superset of data points incorporating national and cross-border requirements, this can be easily extended to facilitate adaptation and adoption by other countries across Africa as well as around the world. Facilitating configurable mandatory and optional data sets support monitoring and follow-up for more complicated cases and facilitate more accurate and early diagnosis as we continue to evolve mHealth4Afrika by incorporating decision support and other technologies. Based on extensive consultation and analysis, mHealth4Afrika identified the requirement to strengthen digital literacy skills of health workers in intervention facilities to complement application training and general support. Initial intervention health facilities in northern Ethiopia, western Kenya, southern Malawi and the Eastern Cape in South Africa were agreed with the Ministries of Health and the district health offices. These are a mix of primary healthcare facilities and hospitals who do not have access to a complete electronic health record and have not previously used technology at the point of care. DHIS2 is used as a national health information system in many ACP countries, including Kenya, Malawi and South Africa, and is currently being adopted by Ethiopia. For this reason, mHealth4Afrika investigated whether it was possible for a comprehensive and extensible patient-centric multi-program health platform to be built on top of DHIS2. This offers significant benefits. mHealth4Afrika has developed a comprehensive and extensible patient-centric multi-program custom application on top of DHIS2, which interacts via a WebAPI with the mHealth4Afrika data models configured in DHIS2 for each medical program. The data model determines the program structure with its stages, sections, and rules. The mHealth4Afrika application dynamically renders the data model for each program. This significantly reduces maintenance costs, making it easier to modify and adapt programs without the use of scarce and expensive technical resources. This design decision supports adaptation, extensibility, and scalability of mHealth4Afrika in resource-constrained environments. It also facilitates automatic generation of aggregate program indicator data for the Ministry of Health. As well as saving facilities up to 5 person days per month, precious time that can be reallocated to clinical care or continuous professional medical education, mHealth4Afrika can guarantee access to timely, accurate aggregate data used to inform health policy and resource allocation. Our approach to interoperability has focused on using HL7 FHIR, initially to transfer medical sensor readings and lab requests and results to and from the patient EMR. To support patient mobility and referrals, mHealth4Afrika will use HL7 FHIR to support the export and import of individual electronic medical records. mHealth4Afrika functionality, user interface, and supported programs has evolved significantly over the past 3 years. We responded quickly to feedback received to iterations of the Alpha and the Beta platform. Based on the level of trust established through this co-design process, user requirements and input have also evolved in sophistication as participating stakeholders realize what has been achieved to date and expectations increase accordingly. While we initially focused on maternal and child health, once these programs have been successfully implemented, stakeholders strongly encouraged us to extend functionality and programs supported to provide a comprehensive and integrated solution that would facilitate a holistic cradle-to-grave approach to patient care. mHealth4Afrika now incorporates an extensive set of programs and functionality prioritized by participating key stakeholders, including automated counting of program indicators, SMS appointment notifications, and lab result integration. From a clinic perspective, mHealth4Afrika facilitates setting up, viewing, and editing healthcare workers as system users and assigning program access rights based on responsibilities. The system user can add, view, or edit a new patient record and search the patient list. They can add, view, or edit patient appointments, search the appointment list, and set up SMS notifications. And they have access to a dashboard which provides facility reports and monthly program indicators. In terms of patient-related functionality, this is centered around a patient profile, which provides a dashboard presenting demographic and program-specific information, appointments, risk factors, and visualization of program-specific readings and measurements. Each program allows data to be added, viewed, and edited during visits. The programs that have been validated to date include medical history, maternal health, family planning, cervical cancer screening, child under 5, tuberculosis, ART, diabetes, and general and clinic-specific outpatient department. Comprehensive patient records are also automatically generated by program and can be printed and exported for further analysis. Health facilities of different sizes may support different programs. The clinic manager can easily select the appropriate programs, set up system users, and assign program-specific access rights based on their responsibilities. I'm now going to briefly show a demonstration of some of the mHealth4Afrika functionality. The version I'm demonstrating is for a health facility in Ethiopia. One of the practical challenges that mHealth4Afrika faced is supporting 2 different calendars, Gregorian and Ethiopian, without having to support 2 different code bases. We've addressed this through a data conversion within the mHealth4Afrika application. While all dates are stored in DHIS2 using the Gregorian calendar, when used in Ethiopia, dates are presented to the user using the Ethiopian calendar. When Ethiopian dates are input, they're saved in the Gregorian calendar. This allows us to maintain one code base while meeting Ethiopian healthcare expectations. When the health worker logs in, they come to the patient list. I'm now logged in as the facility manager, so I have access to patients across all programs. From a clinic perspective, I have access to an overview of the appointments, the healthcare workers who are system users and their access rights, and a dashboard providing access to program indicators and facility reports. We started from the perspective of maternal health and child under 5. Then, based on the requirements from the end users, we added family planning, cervical cancer screening, then ART and TB, and then general and specialist outpatient departments. When the user wishes to access a patient file, they can search by name or they can search by field. Then they click on the patient that they want to view, and they click View Profile. So we're now going to look at a patient that is registered for a number of programs, but in her case, we're going to specifically look at maternal health. So when we come to the patient profile initially, we have access to a dashboard which provides information on the demographics, and we can view and edit the demographics. And we have access to risk factors that are added by the healthcare workers and a risk profile that's generated by the system as part of decision support. So this is dynamically rendered based on the programs that the person attends and the data points that our data is captured for. So in the case of blood pressure, pulse, blood oxygen saturation, and temperature, this reflects the reading from the last visit, irrespective of which program it's related to. If the healthcare workers collect height and weight, the system generates the BMI. And then for specific conditions, it highlights whether the person's at risk or whether they're within what's perceived to be a clinical normal range. We're now going to look at maternal health. So when we click on maternal health, it brings us into an extended dashboard. So we still have access to the patient demographics, we have access to the risk profile and the risk factors, and we have access to visualization. So in the case of the maternal program, it dynamically renders data points based on each visit, and this allows the nurse to see if the patient is within normal ranges and if they're within normal ranges for this person's specific conditions. Within maternal health, we now see that this patient has attended several pregnancy tests, and we can click on the specific visit and access it. And then we can click on the pregnancy itself, a pregnancy cycle, and we have access to all of the ANCs. So here we see that from a pregnancy perspective, the healthcare worker has the ability to set up visits across 8 antenatal care visits, delivery, and 3 postnatal care visits. Here we see the appointments that the person attended, and here we have access to the visualization, which is dynamically rendered. So in the case of the maternal program, it's configured for blood pressure, temperature, weight, abdominal circumference. If the facility uses an oximeter, they can see the pulse rate and the blood oxygen saturation, and it also facilitates monitoring of the fundal height of the child. So then when we go into a specific stage, we see how the decision support is rendered to the healthcare worker. So when they save the form, it highlights if specific readings are within normal ranges, and then in terms of screening, it highlights whether the person is at risk or whether the person is within a normal range. So here it highlights that rhesus and syphilis are at risk. We're now going to look at a patient who is registered in the Child Under 5 programme. So we keep the dashboard structure the same across all programmes because in most facilities there is a rotation of staff. So the look of the electronic health record needs to be similar regardless of which programme the nurse is dealing with at a point in time. So here we've access to demographic information about the child. We have access to the different programme stages, which in the case of Child Under 5 is at birth consultation, then growth and nutrition, childhood illnesses, immunisation, vitamin A and deworming are set up as repeatable stages. So this means that when the mother brings the child to the facility for one of these consultations, then the data is collected at that time when the child comes. For Child Under 5, we render from a data visualization perspective the WHO graphs. So weight for age, weight for height, then length for age, and then we also render MUC. So this allows the nurse to see that the child is progressing in the right direction. We'll now look at a patient who's registered in the tuberculosis programme. So the TB programme has been extended through consultation with specialist clinics in hospitals. So now it supports the full continuum of care for this condition. So in some countries, the hospitals undertake IPT therapy. Where a patient has been in contact with a TB case, they need to be tracked, and this registry is called contact management. Then for normal interaction, TB screening can be voluntary or as a result of TB tracking. And here we see an overview of the main data points collected during that visit, and then we can click on the visit and see more details, or we can look at the reports. If the person has the condition, then they undertake TB consultation, and here we get the view of the data of the drug regime and their adherence. And then if the person becomes multi-drug resistant, then they can add data points for category 4 consultation. In the case of TB, we dynamically render blood pressure, temperature and weight. The patient profile section is program specific. So in the case of TB, we show the last vital signs, and then the TB summary allows you to see the drug regime and the adherence based on the last visit. This patient is registered for ART, so we have access to the risk factors, the risk profile, the reports and the stages. So in the case of ART, there's voluntary ART screening, which we call pre-ART, and then if the person has the condition, there's ART consultation. mHealth4Afrika has introduced sensors at the point of care. So healthcare workers are using a range of CE-approved Bluetooth sensors to measure pulse and oxygen, blood pressure, temperature, sugar levels, weight and hemoglobin. mHealth4Afrika has developed an Android application to display the sensor readings and a HL7 FHIR service to pass the sensor readings to the electronic medical record via the DHIS2 WebAPI. When the nurse logs into the Android application, it undertakes user authentication and renders the patients and the programs for which this nurse has permission. They can then retrieve and synchronize the patient list with the electronic medical record. It displays the sensor readings using Bluetooth LE, and then it passes the sensor readings to the electronic patient record using HL7 FHIR. The mHealth4Afrika Consortium brings together multidisciplinary research and innovation expertise, including human-computer interaction, cross-platform mobile technologies, sensors for healthcare, health informatics, end-user-driven needs assessment and evaluation, and program-specific expertise. We We have co-designed a state-of-the-art patient-centric health information system designed to improve healthcare delivery in hospitals and primary healthcare facilities in resource-constrained environments. It has been co-designed and validated with Ministries of Health, district health officers and clinicians in Ethiopia, Kenya, Malawi and South Africa. It works in both an offline and an online mode, and it supports prevention-focused healthcare delivery. It's now being used in a mix of primary healthcare facilities and hospitals, and it supports a wide range of medical programs to support a holistic cradle-to-grave approach to patient care. It's currently available in English and French. We are now engaging with Ministries of Health who weren't involved in the initial co-design process to validate the system functionality, programs, and identify opportunities to scale implementation in both existing beneficiary countries and new countries. Thank you for your attention. We look forward to further engagement. You're welcome to send questions by email.